Okay, this is the second video for the exam previous questions. This is 2001 paper, starting from question number 11 here. So question number 11, the first part is talc is a form of calcium carbonate. That is false. Talc is magnesium trisilicate or magnesium silicate also. So it is not calcium carbonate. Okay. Now B, some tablets are found as coated tablets. That is true. The coating is in different forms: sugar coating, enteric coating, film coating. So the purpose of coating is different. For film coating, it may be to protect from environment or give a better color to the tablet, or it may be to cover a smell of the tablet, bad smell, bad taste. Enteric coating is to prevent the tablet getting destroyed in the acid medium, or the tablet ingredients may irritate the gastric wall, that is, so can cause gastric irritation. So for those two reasons, enteric coated tablets are covered with a layer called that is called enteric coating. The base of an ointment is usually hydrous. There are hydrous ointment bases, but most of them are anhydrous. They are typically hydrocarbons. So Gulad lotion has silonitrate as an ingredient. Gulad lotion is lead subacetate. It is, you can't give to drink because it is a lead compound. It is applied outside the body. So skin ailments, inflammation of the skin. E, the vehicle of a skin ointment does not have pharmacological properties. So that is false. If it is a hydrocarbon ointment base, that can prevent evaporation of moisture from the skin. So they are moisturizing action and soothing effect. So many pharmacological effects are there from the ointment base or vehicle. Number 12, true or false about disintegration test for tablets. Disintegration test is done to make sure that the tablet will get disintegrated before dissolution. It will get disintegrated or form small particles, break down and form small particles within the desired time and in the desired place. So question A, soluble aspirin tablets should disintegrate within 3 minutes. That is true. All soluble tablets are getting disintegrated within 3 minutes. So soluble aspirin has citric acid, anhydrous, and sodium saccharin as a sweetening agent, calcium carbonate, to react with citric acid and to produce carbon dioxide. Maize starches to absorb moisture from when it put into the water. So the time is 3 minutes. The disintegration test is not applicable for modified release tablets. Modified release means it is not like ordinary traditional tablet. It will not get break down quickly. It will not give the whole thing for solution immediately like other tablets. So it is timely release tablets. But disintegration test was not done sometimes like 10 years before for those tablets. But now they are doing disintegration test for delayed release tablets. So modified release tablets are now undergo disintegration test. So normally disintegration test is done for almost all the tablets. Operate the apparatus for 2 hours in acid medium. This is the enteric coated tablets. Enteric coated tablets are covered with this cellulose acetate phthalate, at least remember this one. And the tablet is kept in acid medium, similar to gastric acid, for 2 hours, and the tablet should not be broken or nothing should happen to the tablet. After 2 hours in the acid medium, then the same tablet is passed into another medium similar to duodenal or intestinal medium, that is pH 6.8. So that in that pH, the tablet should disintegrate within 1 hour. This chart slowly write down and keep in your memory. This is how film coating is done. The purpose is to increase shelf life, mask the taste, control the release of the tablet. You have to write down this in SEQ papers. The thickness is less than 100 microns. When it is film coated tablets, it is 100 microns. Sugar coated tablets, it is more than that. Types of coating: film coating, sugar coating, and press coating. So this is how the coating is done in the pan. Coating solution is sprayed on the tablets and pan is rotating. It is like a concrete mixer. Disintegration time is the time taken for a tablet to break down into fine particles. That is true. Everybody knows that. Disintegration time is measured as an indicator of the pharmacological efficacy. No, pharmacological efficacy is something else. This is false. Go to number 13. True or false? Leucols iodine contains 5% weight by volume iodine. That is true. This Leucols iodine is given as a medication for hyperthyroidism. Then thyroid storm is the last stage of hyperthyroidism. Patient get very badly affected. It is life-threatening situation. And also this solution is given to patients before surgery, before thyroid surgery. So to shrink, that is, bring down the size of the thyroid. Tincture of iodine contains 6% iodine. True. Tincture always contain alcohol. That is the difference. Dissolved in water, potassium iodide, and alcohol. Lasers paste contains 24% of weight by volume zinc oxide. Lasers paste contain, that is true. Lasers paste contain 24% zinc oxide, salicylic acid 2%, Other things are small quantities of paraffin, may starch, whites of that is the base old fat. D. Potassium citrate mixture contains sodium carbonate. In hospital pharmacy, they give as Potsit, potassium citrate, to make the urine alkaline, because certain drugs, especially antibiotics, work only when the urine is alkaline. So to make the urine alkaline, they give this mixture potassium citrate. It doesn't contain sodium carbonate. Calcium lotion contains, calamine lotion contains 0.5% glycerol. It is 6.3% glycerol. You have to know the formula of calamine lotion. We'll go to question number 14. True or false? Potassium permanganate aqueous solution is a weight by volume solution. Potassium permanganate aqueous solution is a weight by volume solution. That is true, because potassium permanganate is a solid. So you weigh in grams and dissolve in water. So it is weight by volume. Menthol is in eucalyptus oil is volume by volume. That is also true, because menthol is a solid. So that is false. Sorry, that is false. Menthol is a solid. So at room temperature, menthol is a solid. So it is false. Boric acid in yellows of paraffin is a weight by weight solution. Boric acid in yellows of paraffin is a weight by weight solution. Boric acid in yellows of paraffin is a weight by weight. Yes. You can say it a mixture also. It is weight by weight because boric acid and sulfurine both are solids. See, the liquid paraffin is in whites of paraffin is a volume by weight. That is true, because liquid paraffin is a liquid and white of paraffin is a solid. So you add liquid to the solid and make the mixture. So it is volume by weight you get. Benzyl benzoate is a volume by volume solution. Now benzyl benzoate, that is BB cream, is a not a solution, it is a suspended medium, that is and benzyl benzoate melting point is 16, so it is a liquid above 18. It is a thick liquid at room temperature and make a suspension with water, not a solution. True or false about comminution? Comminution is in the process which brings the particle size very small. A solid can be made into a small particles. Micronization. A part A. Micronization is different from comminution because micronization produce a nano-size particles, very small particles. So the question is, micronization cannot be achieved with domestic grinders. True. With domestic grinders, you can't reach the micron size, very, very small size, you can't reach. So it is true. It has to be in the manufacturing level, jet mill, hammer mill, and those very fine particles you get in manufacturing area. Combination is a crystalline substance. Combination of a crystalline substance result in the reduction of the substance into a fine particles. That is true. See, coarse and fine particles resulting from combination of the same drug substance have the same solubility rate. Now, when you grind, you get large particles and also small particles. So, small particles are called fine particles, large particles are called coarse particles. So, coarse particles are larger than fine particles. So, when you put into the water solution, so fine particles have bigger surface area, it will quickly dissolve than coarse particles. Coarse particles dissolve but slowly, slower than fine particles. Trituration is technique of comminution. Trituration is mixing two solids. So it is not a combination. Combination plant material leads to reduced extraction of active principles. Now, combination is the way that you bring the particle size down, make smaller particles. So when you take plant materials, the best thing is to cut into pieces. That is again combination, bring the sizes smaller. Then the extraction is easier than putting the whole plant. When you put the small particles, extraction of the active ingredients is easier. So E is false. 16. True or false about filtration. Now, dispensing grade sterile filtration can be achieved with sterilized glass filters. Sorry, sintered glass filters. Sintered glass filter is a filter with 0.22 micrometer force. When you filter, the flow size is size of the opening. So this is 0.22 micrometers. Should be less than 0.22 micrometers for to separate bacteria. Bacteria can go to this size. Absorbent cotton plug is in a funnel serves well for routine filtration in dispensing. That is false. But no plug is not a good one. Yellow wax is purified by cold filtration. You can't do that because yellow wax melt above the room temperature. So that is false. D, 10 micrometer membrane filter. This is called membrane filter. Suit sterile filtration. Bacteria is separated only with 0.22 microns or less pore size. Modern intravenous administration sets have a built-in filter device. That is true. All IV sets have filter device. Number 17, true or false. Large volume intravenous preparations contain a small amount of antimicrobial preservative. Large volume means the size of the parenteral preparations. 100 ml less than 100 ml preservative plus. If it is a single use dose, they don't normally put any preservative, otherwise preservative, they put a preservative. Then more than 100 ml, that is like say like 0.9% saline sodium chloride. So this one, no preservative. So large volume parenteral preparations don't have preservatives. Epinephrine injection can be dispensed for adrenaline injection. Epinephrine and adrenaline are the two names given to the same compound. Epinephrine name is used in USA, adrenaline in UK. That is the difference. So it is the same compound. Reconstituted benzyl penicillin injection can be used up to 1 week. Reconstituted benzyl penicillin injection can be used up to 1 week. So benzyl penicillin is natural penicillin and it will get hydrolyzed very quickly. So you never keep it for maybe in 1 hour, 2 hours, okay. Otherwise, you have to give the injection immediately after reconstitution. What happens is it gets hydrolyzed. Dehydrated and lanolin is another name for wool fat. Wool fat is anhydrous lanolin. Once water is absorbed, it is hydrated lanolin. Wool fat is anhydrous lanolin. Wool fat can absorb 30% of its water, 30% of its weight of water. So it can absorb large quantity of water. Then it becomes hydrated lanolin. It is not called wool fat anymore. Disposable syringes are sterile, that is true. So go to number 18. Peppermint oil is an example of a fixed oil. Peppermint oil is a volatile oil. It gets quickly evaporated. It's a volatile oil. The sodium citrate is hygroscopic. No, potassium citrate is hygroscopic, not sodium citrate. Silica gel is a hydrating agent. Silica gel is a dehydrating agent. It removes water. Soda lime turns blue following reabsorption of water. That is false. Soda lime always calcium hydroxide, sodium and sodium hydroxide. That mixture is always white. The only compound that turns blue after absorption water is anhydrous copper sulfate. Anhydrous copper sulfate is a gray color powder. When it absorbs moisture, it becomes blue. Then E, the batch number of a pharmaceutical product is given by the pharmacist. The batch number of a pharmaceutical product is given by the pharmacist, that is given by the manufacturer, not the pharmacist. True or false about vaccine and serum? Tetanus toxoid is recommended to be stored in the freezer. Tetanus toxoid is recommended to be stored in the freezer. Tetanus toxoid is kept in the middle of the fridge, not in the freezer. 2 to 8 degrees centigrade is the storage temperature for tetanus toxoid. Strength of BCG vaccine is expressed as the number of organisms per given volume. BCG vaccine is supplied in the box. Or vial, it contains 8 into 10 to the power 8 colony forming units. That is the number of live organisms. Number of live organisms. So it is true. Anti-tetanus serum gives long-lasting immunity. Anti-tetanus serum gives long-lasting immunity. This is an anti-serum. For immunity, you can have active immunity or passive immunity. Active immunity you get from vaccine or by getting the illness. Immunity and passive. Active immunity you get by vaccine or by getting infection. Passive immunity you get from, again, anti-sera. Passive means the antibodies are prepared. EV means antibodies from another person. Another person means animal or maybe human. Another person. So this passive immunity will be diminished or will go away after 1 or 2 weeks, few weeks. This is permanent. Active immunity lasts longer. So D, MMR refers to the mumps, measles, and not rabies, rubella. Anti-snake venom serum is recommended to be stored between 2 to 8. No, anti-snake venom, actually people take it when they walk in jungles. So they can't take a fridge there. So they can't take in ice also because it may be some days or weeks in the jungle. So it is prepared in the powder form, that is freeze-dried powder. That is called lyophilization. Freeze-dried powders can be kept at room temperature. So they take the powder and also the diluent. The injection, if there is a snake bite, they immediately get it. So even hospitals, the same thing is done. It is never frozen. Number 20, true or false, transdermal patches containing drugs are used for their local action. Transdermal patches, very common one is a GTN, glycerol trinitrate, that is for angina. So transdermal patches are given for systemic action also. Maybe local action. They are most commonly given in when they need systemic action. GTN is a good example. Estrogen is given this way. Some family planning drugs are given in patches. Hormone therapy. So this is false. 20 is false. Levamisole bolus is veterinary preparation, that is true, that is given for worms in animals, especially roundworms. Oxytocin is recommended to be stored at room temperature. Oxytocin is recommended to be stored at room temperature. That is, when you have to say for 2 years, it should be in the fridge. 2 to 8. For 3 months, you can keep in the outside. Now it is for 3 months you can keep at room temperature, otherwise in the fridge. So this is false, because storage means it means a longer time. 28 gauge needle is recommended to be used for intravascular injection in adults. That is false. 28 gauge needle is very small needle, like insulin needle. Insulin is given between 26 and 30 gauge needles. So this is false. Intravascular injection, normally they use 23. So between 22 and 25 they can use. Strength of vitamin A is expressed in milligrams. That is false. Vitamin A and also vitamin D is given as units. In units. 20. Let's see. Okay, thank you. We will give the other questions next time from 21. So these questions are actually easier than the present day questions, because it is 2001, but I am going to do everything from 21, 22, 23 like that to up to now. So start with this. This is comparatively easier than today's exams. So, but still this will give you some knowledge. Okay, thank you very much.